Hey, clinical folks. So this video is to walk you through the case study of Rev X, which is our behavioral case study. It really talks about exposure therapy. This is a hard one. This is one where you're not going to like the client and where it's hard to read about, especially if you know anyone or you yourself has a past related to this. So just heads up on that. All right, so we've got Reverend X, and he's 51 years old, and he's a married minister from the Midwest. So he's presenting problems or symptoms. The biggest issue, and why none of us like him, right, is that he's got heterosexual pedophilic behavior. He's been touching and caressing girls between the ages of 10 and 16 for 20 years, and just like going on with his bad self, and no one's been stopping him. 50 girls have been abused by him, and he was suspended from one church, but got a position in a different state. And this is a lot of what's happened in several different denominations, including the Catholic Church. If you want to see a really good depiction of that, you can watch the movie Spotlight, which I think is streaming, about the reporters who broke that story. And he has no remorse. He acknowledges that it's strange, but he's like, I don't feel bad about it. And this is very common with pedophiles. So I've told you, I think, a lot that there are most diagnoses in the DSM have like significant distress or impairment on the part of the person who's doing it as part of the diagnosis or experiencing it. For pedophilia, you don't need that. Right? We already know that this is causing significant distress or impairment for the child. So we don't mess around. We don't care if the person feels bad or not, because we know how damaging it is. The vast majority of clients with PTSD I worked with when I was a clinician had a history of childhood sexual trauma. A lot of my eating disorder patients did, and they would either not eat or overeat in order to change their body to not be desirable to their abuser anymore. So this has serious consequences. And we acknowledge that, and that's why that person doesn't have to be distressed. We don't care if they're distressed. This is a psychological disorder, and it's something we need to change. And obviously something that's illegal as well, for all those same reasons. So in terms of his personal and family mental health history, he had 3 grown children. He had a boy and 2 girls. And again, he didn't feel remorse. He just worried about being found out. He never approached his own children sexually. He didn't expose himself or ask girls to touch him, so I guess he thought that made it more okay. And he would masturbate to pornography that specifically was related to the small breasts of adolescent girls. So clearly this is how his sex drive is connected. He had few contacts with girls as a teen. He did start dating at 22. He got married at 26. Like many religious individuals, that was the first time he had sex. And he said his sex life with his wife is normal and satisfying, which we don't typically think of someone with pedophilia. But for him, he had interests both ways, and it works for him, but clearly doesn't work for his victims. Now, he had a couple of years of behavioral therapy. I have to say this is a little unusual for these types of therapies. Typically, these are pretty short, but changing something like pedophilia does take a long time. So I love that they acknowledge this in this particular case study. This is written by one of the leading people in behavioral therapy. So I'm glad that you got to read this by him. So they used what is called covert sensitizations. The idea here is you try to associate the behavior with something really unpleasant. And sometimes this is done in really simple behavioral ways, like if it's something not that bad, like you're biting your nails and you don't want to. Sometimes people will just wear a rubber band around their wrist and then snap it on themselves when they do the behavior they don't want to do. You can do this for stuff like alcohol. So there's actually, for people who are alcohol abusers, there's a medication they can take called antabuse that just makes them feel really, really sick when they drink it all. And so that's a behavioral as well as a medical treatment, because then you associate the alcohol with that feeling of sickness. Um, so what they did here with the therapist, which I thought was actually sort of a novel and interesting way to tackle this, is they did it imaginally, obviously. Like, you wouldn't want to do that. But he actually brought in elements that would make this really aversive to the client, to make this to engage in the covert sensitization. So he would walk the client through the scene, walk Rev X through the scene, imagining something arousing, and then bring up something aversive. Being caught by his family, thinking about throwing up, that was particularly aversive to this person. Or I think at one point he had him think about, like, what if this happened to your daughter and you saw it, right? And that was really eye-opening for the client. And then he taught the client to do this to himself. So every time he started to be turned on by something that was clearly inappropriate, the client on his own would do this, think of something aversive, to try to counteract that. Now, other ways this has been done for people like pedophiles and other paraphilias in the past, sometimes they've actually sent a shock to people when they do this, and particularly on the penis. So clearly he chose not to do that, but sometimes covert sensitization is actually that obviously behavioral. And so that's one way to do it, clearly not the way that Lewinson chose to do it here. So this client did have strengths. Again, it's hard to see, but it's really important as a therapist to think about what strengths are my clients bringing here, right? So he did have a deeply religious attitude about his convictions in general, although, again, somehow this sat within that. The rest of us, it doesn't make sense, right? But it did to him. He adapted well to a new location. He was able to get a new job. He volunteered in his community. His marriage did improve, and his wife stuck by him. So that, that's something. Difficulties encountered during therapy. I've mentioned this several times, but when a client doesn't feel remorse, it's really difficult to get them to change. One of the things I often told my clients, and this is something I actually got from when Tim Gunn had his own show for a couple seasons called Tim Gunn's Guide to Style, one of the things he would say to people is, I can't want this for you more than you want it for yourself. Right, so that makes it really tricky when a client comes into therapy and they're like, no, I feel like I need to change, right? They have to want to change. So you have to really engage in sometimes like that motivational interviewing to find out, like, where can we find a reason for you to make this change? He was outcast from his community. And he suffered depression after he found out people were spreading rumors and not just welcome him back. Again, like, it's strange to us that this would be shocking, but it can be to people who, again, like, he in his own mind somehow didn't see what was wrong with this. So this was effective for both the client and the therapist. The therapist talks about how difficult this was for him, right? I personally have never treated perpetrators. I've only treated survivors of sexual trauma. And I feel like it would be really difficult to do that, right? Because you've got to find empathy for this person that you don't feel like should have empathy at all, right? So he had zero arousal after 18 months' time to pedophilic ideas. That's huge, right? And his sex life was more satisfying with his wife. His relationship improved with his life. And then, like, one thing that's not on here, but clearly is, like, he's not abusing little girls anymore, right? So that is probably the best outcome of this, is that there are no more girls who will be abused by this man, right? And suffer the consequences. So again, thanks for hanging in there for this pretty difficult case. And I hope that it shows how these behavioral principles can be really effective and help with really difficult problems with individuals. Again, like, sitting and, like, doing psychoanalysis or even client-centered therapy with this guy probably wouldn't work. But something that focuses particularly on the behavior and changing the reaction to it, that's what worked in this scenario.